Hey guys, tonight on Margaret Radio Health in Later Life, we're gently unwrapping a topic that many of us, especially as the years add their gentle weight, become quite familiar with. We're talking about that quiet companion, sometimes a dull ache, sometimes a sharper reminder, that often settles in our backs. Yes, we're exploring why back pain often increases as we age. Imagine, if you will, settling into your favorite armchair after a day that's had its share of little efforts. Perhaps you've been tending to your garden, those roses won't prune themselves, or maybe you've been delighting in the laughter of grandchildren, which, let's be honest, is a wonderful workout in itself. And as you sink into that chair, there it is, a gentle sigh from your lower back, a subtle stiffness that reminds you of the day's activities, or perhaps, of the many days that have come before. It's a common tale, one whispered in quiet conversations between friends, often accompanied by a knowing nod. You might find yourself wondering if every creak and groan is a new, permanent fixture, like that one floorboard in the hallway you can never quite avoid. Sometimes, I think my own body keeps a more detailed diary of my life than I do, especially when it comes to these little reminders. It's almost as if our bodies are trying to tell us stories, and tonight, we're going to listen very carefully to one of those stories, the story of our backs and the journey they take with us through life. We're not here to jump to alarming conclusions or to wade through complicated medical texts that feel like they require a secret decoder ring. Instead, think of this as a quiet chat, a way to understand our bodies with a bit more kindness and a touch more clarity. We're aiming for that feeling of a soft blanket wrapping around you, bringing comfort and a sense of ease as we talk through these things together. Because understanding is the first step towards feeling a little bit more in control, a little more at peace with the changes that life brings. It's about finding that gentle path to acknowledging what is, and perhaps discovering how to navigate it with grace. We often hear about back pain, it's a phrase that floats around, but tonight we want to look a little closer, with gentle eyes, at why it seems to become a more frequent visitor as we gather more candles on our birthday cakes. It's not about dwelling on the discomfort, but rather about illuminating the path to better understanding and, hopefully, greater comfort. Many of you might wonder, is this just part of getting older, or is there something more to it? And that's exactly what we're going to explore. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Your support truly means the world and helps these quiet conversations reach more people who might find a little bit of solace or understanding within them. And while you're at it, I'd love to know where you're tuning in from tonight. Go ahead and type your current location and your local time into the comments below. It's always so wonderful to see our little community stretching across so many different corners of the world, all settling in for a moment of shared learning and relaxation. It paints such a lovely picture in my mind, knowing we're all connected in this quiet space, even if miles apart. Now, dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. Let the sounds of your evening settle around you, and allow your body to relax, perhaps noticing where it feels most at ease, most supported. We're going to explore this topic with the gentleness it deserves, unraveling the threads of why our backs might ask for a little more attention as we navigate the rich tapestry of later life. It's a journey of understanding, and every step, every piece of knowledge, can make the path ahead feel a little smoother, a little more understood. As we begin, just allow your breath to deepen, feeling that sense of quiet anticipation, not for anything strenuous, but for a period of calm learning and gentle reflection. We're not rushing, we're simply allowing ourselves this time to connect and to comprehend. So, as we settle deeper into this quiet space together, let's gently turn our attention to the heart of our conversation tonight, understanding the reasons why your back might be asking for a little more of your attention as the years gracefully unfold. It's a question many of us ponder, perhaps as we bend to tie a shoelace or after a pleasant afternoon spent in the garden, noticing that familiar ache or stiffness. You might find yourself wondering, why now? What's changing? And these are very natural questions, born not of complaint, but of a desire to understand our own bodies better. Think of your spine, for a moment, as the mast of a beautiful, resilient ship that has sailed through many seasons. It's a marvel of engineering, composed of individual bones called vertebrae, stacked one on top of the other, creating a strong yet flexible column. Between each of these vertebrae, you have these wonderful little cushions, known as intervertebral discs. In your younger years, these discs are plump and full of water, acting like perfect little shock absorbers, much like the suspension in a well-maintained car, smoothing out the bumps in the road of daily life. They allow your spine to twist, to bend, to move with an easy grace, absorbing the pressures of walking, lifting, even just sitting. It's a system designed for incredible adaptability. Now, as we journey through life, these discs naturally begin to change. This is a very common process, something that happens to most everyone to some degree. It's a well-established health fact that these intervertebral discs gradually lose some of their water content and elasticity with age. Imagine a grape slowly becoming a raisin. It doesn't mean the raisin is bad, it's just different, more concentrated, a little less pliable. Similarly, your spinal discs might become a bit thinner, a bit drier, and a little less springy. This process is often referred to by medical professionals as degenerative disc disease, though that name can sound a little more alarming than it often is in reality. For many, it's simply a natural part of the aging tapestry, a testament to the years of support your spine has provided. When these discs become less cushiony, they can't absorb shocks quite as effectively as they once did. So, the little impacts of daily movement, stepping off a curb, or even a more vigorous sneeze, might be felt a bit more directly by the vertebrae themselves or the surrounding structures. You might notice this as a sense of stiffness, especially in the morning when you first get out of bed, or perhaps your back feels a little less forgiving after a long period of sitting or standing. It's as if the give in the system has reduced slightly, and your body is gently letting you know. Furthermore, as the discs thin, the space between your vertebrae can narrow, and this can sometimes mean that nerves exiting the spinal column have a little less room, which, for some, can lead to feelings of discomfort, perhaps a radiating sensation or a localized ache. It's one of the primary ways your back communicates that its internal landscape is subtly shifting. Many people ask, does this mean I'm going to be in constant pain? And the answer is, not necessarily at all. The degree to which these changes are felt varies enormously from person to person, a bit like how some people get grey hair earlier than others. It's an individual journey. Alongside these changes in the discs, another common factor involves the small joints in your spine, called facet joints. These are the articulations on the back part of your vertebrae that help guide and restrict movement, allowing you to bend and twist safely. Just like the cartilage in your knee or your hip, the cartilage covering these facet joints can also wear down over time. This is essentially osteoarthritis, and when it occurs in the spine, it's sometimes called spondylosis. Think of it like the tread on a well-loved pair of walking shoes. After many miles, the tread naturally wears thin. When the cartilage in your facet joints becomes thinner, the bones can rub more closely together. Your body, in its innate wisdom, sometimes tries to stabilize these areas by forming tiny extra growths of bone, known as bone spurs or osteophytes. While these are a natural response, like the body trying to build a little extra support, these spurs can sometimes press on nearby nerves or restrict movement, contributing to that sensation of stiffness or a deeper ache, particularly with certain movements. You might notice that twisting to look over your shoulder feels a bit more restricted, or that your back feels generally less supple than it used to. This isn't a sign of failure, it's more a reflection of a lifetime of movement and service from these diligent joints. This brings us to another aspect that can play a significant role, especially as these arthritic changes progress, and that's a condition known as spinal stenosis. The word stenosis simply means narrowing. In spinal stenosis, the spinal canal, that central tunnel within your vertebrae through which your spinal cord passes, or the smaller openings where nerves branch off, foramina, can become narrowed. This narrowing can be caused by a combination of factors we've touched upon: bulging discs, thickened ligaments, which we'll talk more about, and those bony overgrowths from osteoarthritis. Imagine a garden hose that gets a slight kink in it, the flow of water is impeded. Similarly, when the spaces within your spine narrow, they can put pressure on the spinal cord or the nerve roots. This pressure can lead to a variety of sensations. You might experience pain, not just in your back, but sometimes radiating into your buttocks or legs. Some people describe a heaviness, a numbness, or even a weakness in their legs, particularly when standing or walking for a period. You might find that bending forward or sitting down brings a sense of relief, and this is a common characteristic because those positions can temporarily open up the spinal canal a little, easing the pressure. It's one of those things where your body intuitively guides you towards what feels better. You might find yourself looking for a place to sit while shopping, or noticing that your walks are becoming a little shorter before you need a rest. This isn't unusual, and it's your body's way of signaling that the nerves need a bit more space. People often wonder if this condition will inevitably worsen, or if there's anything that can be done, and these are points we will certainly touch upon when we explore solutions a little later. Now, let's consider the muscles that support your magnificent spine. Your back isn't just bones and discs, it's intricately supported by a network of muscles: your core muscles, your abdominal muscles, and the muscles running right alongside your spine. These muscles act like a natural corset, providing stability, supporting your posture, and helping to distribute the loads that your back experiences every day. As we age, it's quite common to experience a gradual loss of muscle mass and strength, a process known as sarcopenia. This isn't something that happens overnight, but rather a slow, subtle decline if we're not actively working to maintain muscle health. When these supporting muscles, particularly your deep core muscles, become weaker, they are less able to do their job effectively. This means that more stress and strain can be transferred directly to the discs, the joints, and the ligaments of your spine. It's like having fewer guy ropes supporting a tent. The tent poles, your vertebrae, have to bear more of the burden and are less stable. You might find that you tire more easily, or that activities which once felt effortless now require more exertion and perhaps leave your back feeling vulnerable or strained. Maintaining muscle strength, even with gentle exercises, becomes increasingly important as the years go by, acting as a protective friend to your aging spine. It's a comforting thought that even small, consistent efforts to keep your supporting muscles active can make a noticeable difference in how your back feels. This is a lovely, lesser-known insight for many. You don't need to become a marathon runner. Simple, regular movement can be incredibly beneficial. Then there's the matter of our bones themselves. You've likely heard about osteoporosis, a condition where bones become less dense and more porous, making them more susceptible to fractures. While we often associate osteoporosis with hip or wrist fractures, it can also significantly affect the vertebrae in your spine. Osteopenia is a precursor, indicating lower than average bone density but not yet at the level of osteoporosis. As bone density decreases, your vertebrae can become weaker. Sometimes, even with minimal trauma, like a sudden twist, a cough, or lifting something moderately heavy, a small fracture, known as a vertebral compression fracture, can occur. These fractures can be quite painful, sometimes leading to a sudden onset of sharp back pain, or they can develop more gradually, causing a dull, persistent ache. Over time, if multiple small compression fractures occur, they can also contribute to a loss of height or the development of a more curved posture in the upper back, sometimes referred to as a dowager's hump or kyphosis. This change in posture can, in turn, put additional strain on other parts of your back and neck, creating a cycle of discomfort. Knowing your bone health status, especially as you move into later life, is incredibly important. It's one of those areas where awareness and early intervention, if needed, can play a vital role in protecting your spine from these kinds of painful episodes. Many people aren't aware that these tiny fractures can happen almost silently, or be mistaken for a simple back strain initially. Let's not forget the ligaments of the spine. Ligaments are strong, fibrous bands that connect your vertebrae to each other and help to stabilize your spine, preventing excessive movement. As we age, these ligaments can also undergo changes. They might thicken, or they might lose some of their natural elasticity, becoming a bit stiffer. Imagine an old rubber band that has lost some of its stretch. It's still functional, but it doesn't have the same resilience. When spinal ligaments become less flexible, your spine might feel stiffer, and your range of motion could be somewhat reduced. Sometimes, a particular ligament in the spinal canal, the ligamentum flavum, can thicken to the point where it contributes to that spinal stenosis we spoke about earlier, further narrowing the space available for the nerves. These changes are usually very gradual, accumulating over many years, almost imperceptibly at first. And, of course, we must acknowledge the cumulative effect of a lifetime of use, the sum total of all the little stresses, strains, and occasional injuries your back has patiently endured over the decades. Perhaps you had a fall in your youth, or a job that involved repetitive lifting, or maybe you were an avid sports person. Even minor injuries that seemed insignificant at the time can sometimes leave a subtle legacy, contributing to degenerative changes later on. Think of it as the mileage on a car. The more miles it has traveled, the more likely it is to show some signs of wear and tear, even if it's been generally well looked after. Your spine has carried you, supported you, and moved with you through all of life's ups and downs. Each little twist, bend, and lift, multiplied over years and decades, contributes to the overall story of your back. It's not about blame or regret for past activities, it's simply an acknowledgement of the incredible work your spine has done. Sometimes, you might not even remember a specific injury, but its subtle effects can ripple forward in time. Now, overlaying all these natural, age-related changes are our lifestyle factors. These can significantly influence how, and to what extent, we experience back pain as we get older. For instance, if you've spent many years in a job that required prolonged sitting, perhaps with a posture that wasn't always ideal, this can place consistent, low-level stress on your lower back discs and muscles. Similarly, a more sedentary lifestyle, especially as we age, can lead to a weakening of those crucial core and back muscles we discussed, reducing the natural support system for your spine and making it more vulnerable. It's like a well-oiled machine that starts to stiffen up if it's not used regularly. Movement is key, even gentle movement, to keeping the joints lubricated and the muscles toned. Your body weight also plays a role. Carrying extra weight, especially around the abdomen, shifts your center of gravity forward and places an increased mechanical load on your lower back. Think of it like carrying a heavy backpack on your front all day. Your back muscles have to work much harder to keep you upright, and the pressure on your spinal discs and joints is significantly magnified with every step, every movement. Losing even a modest amount of weight, if you are overweight, can often lead to a surprising reduction in back discomfort. It's a kind gesture to your hardworking spine. And then there's posture. Years of slouching, whether while sitting at a desk, watching television, or even standing, can gradually train your muscles and ligaments into less optimal positions. This can lead to muscle imbalances, some muscles becoming tight and overworked, while others become weak and underused, and this imbalance can be a common source of chronic aches and pains. It's often a very gradual creep, this change in posture, something you might not even be aware of until you catch a glimpse of your reflection or someone gently points it out. Becoming more mindful of your posture, even in small ways throughout the day, can be a surprisingly powerful tool. Repetitive motions, too, can take their toll. If your work or hobbies have involved the same movements over and over again for many years, perhaps a particular way of lifting, twisting, or reaching, this can lead to overuse injuries in specific parts of your back. It's the drip, drip, drip effect. A small stress, repeated thousands of times, can eventually lead to irritation, inflammation, and pain in the affected tissues. There's even some thought given to circulatory changes. As we age, the blood supply to various parts of the body, including the structures of the spine like the intervertebral discs, might become somewhat less efficient. Discs, in particular, have a fairly limited blood supply to begin with, relying on the diffusion of nutrients from adjacent vertebral bodies. If this nutrient supply is compromised, however subtly, it could potentially affect the disc's ability to repair themselves and maintain their health over the long term. This is a more complex area of research, but it highlights how interconnected our bodily systems are. Finally, let's not overlook the role of inflammation. While acute inflammation is a natural and necessary part of the healing process after an injury, chronic low-grade inflammation throughout the body, which can be influenced by diet, stress, and other underlying health conditions, may also contribute to joint pain and accelerate some degenerative processes. If your body is in a state of persistent, low-level inflammation, it can make your joints, including those in your spine, feel more sensitive, more achy, and more prone to flare-ups of discomfort. It's like adding a little bit of fuel to a smoldering fire. You can see, then, that the reasons why back pain often increases as we age are usually not down to one single cause, but rather a combination of these interwoven factors: the natural, time-related changes in your discs and joints, the health of your bones and muscles, the legacy of past activities, and the influence of ongoing lifestyle choices. It's a complex picture, but not necessarily a bleak one. Understanding these underlying processes is the first, most crucial step. It allows us to move away from a sense of vague anxiety or frustration and towards a more informed perspective. You might be listening to all this and thinking, does everyone experience all of these things? Or how do I know which of these is affecting me the most? These are very valid questions, and the experience is indeed unique for each individual. Some people may have significant changes visible on an X-ray or MRI but experience very little pain, while others may have relatively minor changes but feel more discomfort. It underscores the very personal nature of pain and the importance of listening to your own body's signals. It's also reassuring to remember that your body has an incredible capacity for adaptation and healing, even as it ages. Just because these changes are common doesn't mean that significant pain or disability is an inevitable outcome. Far from it. It's like owning a vintage car. It might require a bit more mindful maintenance, a gentler touch, and a deeper understanding of its unique mechanics, but it can still provide many more years of enjoyable journeys. The key is to work with your body, not against it, to understand its changing needs, and to provide it with the support and care it deserves. These age-related processes are not a sudden failing but a gradual evolution. Knowing this helps us to frame our approach to managing back pain not as a battle to be won, but as a partnership to be nurtured. And as we've touched upon, a practical and often comforting insight is to realize that many of these factors are modifiable or can be managed with gentle, consistent attention to movement, posture, and overall well-being. It's not about reversing time, but about optimizing your health within the beautiful context of your life's journey. Feeling a little twinge doesn't always mean something dire is happening. Sometimes it's just your body communicating, asking for a slight adjustment, a moment of rest, or a different kind of movement. And by listening, truly listening, we begin to learn its language. Let's continue to explore these threads, peeling back the layers a little further, always with that gentle curiosity. When we spoke about those spinal discs, those amazing cushions, and how they change, losing some of their water content and becoming a little thinner, it's helpful to understand that this isn't just about them becoming drier. Inside these discs, there's a delicate balance of substances, like proteolycans, which are wonderful molecules that attract and hold water, and collagen, which provides strength and structure. As the years pass, the composition can change, perhaps fewer of those water-loving proteolycans, or changes in the type and organization of the collagen fibers. This internal shift contributes to the disc becoming less resilient, less able to distribute pressures evenly. You might find yourself asking, is there anything that can slow this disc degeneration down? And while we can't turn back the clock on these natural processes entirely, understanding them helps us appreciate the importance of certain supportive measures we'll discuss later. Sometimes, the outer layer of the disc, called the annulus fibrosus, which is made of tough, crisscrossing fibers, can develop tiny tears or fissures. These aren't necessarily dramatic events, but more like small cracks that can occur with wear and tear over time, or sometimes with a sudden awkward movement. The very outer part of this annulus actually has some nerve endings, so if a tear reaches this area, it can be a source of pain, often a deep, aching pain in the back. This is something many people don't realize, that the disc itself can be a source of pain, not just when it presses on a nerve. This kind of discogenic pain might feel worse when you're sitting for long periods, because sitting, especially with a slouched posture, can actually increase the pressure within those lumbar discs. So, if you notice your back complaining more after an hour or two in your favorite armchair, this might be a contributing factor. It's one of those subtle clues your body offers. And as these discs lose a little of their height, even if it's just a millimeter or two per disc, the overall effect can be a slight reduction in the space between the vertebrae. This, in turn, can change the way the facet joints at the back of the spine line up and move against each other. It can mean these joints bear a little more load than they were perhaps originally designed for, which can accelerate the wear and tear on their cartilage surfaces, leading us back to that osteoarthritis or spondylosis we talked about. It's a beautifully interconnected system, your spine, and a change in one part often has a gentle ripple effect on others. It's like a finely tuned instrument. If one string's tension changes, it can affect the harmony of the whole. When we think about osteoarthritis in the spine, it's not just about cartilage wearing thin. There's often a low-grade inflammatory component as well. Chemicals and enzymes are released within the joint that can contribute to the breakdown of cartilage and also irritate the joint lining, leading to pain and stiffness. Those little bone spurs, or osteophytes, that your body so cleverly forms in an attempt to stabilize a joint, usually don't cause pain in themselves unless they grow large enough to press on a nerve or restrict movement significantly. But their presence is a sign that the joint has been under stress and is trying to adapt. You might notice that your back feels particularly stiff first thing in the morning, or after a period of inactivity, and then it gradually warms up with gentle movement. This morning stiffness is a very common hallmark of arthritic conditions. It's as if the joints need a little bit of time to get going, like an old engine on a cold day. People often describe a sensation of creaking or grinding with movement, and while this can sound a bit unsettling, it's often just the sound of slightly roughened joint surfaces moving against each other, and it doesn't always equate to severe damage or pain. Let's revisit spinal stenosis for a moment, that narrowing of the spaces within your spine. We talked about the central canal, where the spinal cord itself runs, and the smaller openings, the foramina, where the nerve roots exit on their way to other parts of your body. Stenosis can affect either or both. If the central canal is narrowed, central stenosis, it can put pressure on the spinal cord, potentially leading to symptoms that affect both legs, like that heaviness or weakness, or changes in balance. If it's a foramen that's narrowed, foraminal stenosis, it typically affects the specific nerve root that passes through that opening, so you might experience pain, numbness, or tingling along the path of that nerve, perhaps down one leg, a condition often loosely referred to as sciatica, though sciatica is a symptom, not a diagnosis in itself. The classic symptom associated with lumbar spinal stenosis is something called neurogenic claudication. This is where you experience that cramping, pain, numbness, or weakness in your legs that comes on with walking or prolonged standing, and here's the key: it's typically relieved by sitting down or by bending forward. Why bending forward? Because when you flex your spine, or lean forward, it slightly increases the dimensions of the spinal canal and the foramina, temporarily giving those compressed nerves a little more breathing room. You might find yourself instinctively leaning on a shopping cart, or needing to sit on a bench after only a short walk. This is your body's clever way of trying to alleviate the pressure. It's a fascinating adaptation. It's worth noting, too, that some individuals are actually born with a spinal canal that is congenitally a bit narrower than average. For these people, even relatively mild age-related degenerative changes can start to cause symptoms of stenosis earlier in life than for someone with a more spacious canal to begin with. It's one of those individual variations that make everyone's experience unique. Many wonder, if I have stenosis, does it mean I'll need surgery? And that's a very common concern. The answer is that many people manage very well with non-surgical approaches, and surgery is typically reserved for more severe cases or when conservative measures haven't provided enough relief. Now, let's delve a little deeper into those supporting structures, your muscles and ligaments. We mentioned sarcopenia, the age-related loss of muscle mass. This doesn't just mean your muscles get smaller, they can also lose some of their power and endurance. The muscles of your core, your deep abdominal muscles, the muscles along your spine, like the multifidus, and even your gluteal muscles, your buttocks, are so crucial for spinal stability. When these muscles are not as strong or as coordinated as they once were, your spine is less protected. It's like trying to balance a tall pole with ropes that have gone a bit slack. It's much more wobbly and prone to toppling. This can lead to muscle imbalances. For example, many of us spend a lot of time sitting, which can cause the muscles at the front of our hips, the hip flexors, to become tight and short. These tight hip flexors can then pull your pelvis forward into an anterior tilt, which increases the curve in your lower back and puts more stress on the lumbar vertebrae and discs. At the same time, the muscles that should counteract this, like your glutes and abdominal muscles, might become stretched and weak from underuse. This kind of imbalance is a very common contributor to lower back pain. You might also find that chronically strained or overworked muscles develop what are known as trigger points, small, hyper-irritable knots within the muscle tissue that can be tender to the touch and can even refer pain to other areas. So, that nagging ache might not just be coming from a joint or a disc, but from the soft tissues that are working overtime to compensate for underlying weaknesses or imbalances. A useful and often comforting tip here is to remember that muscles have a wonderful capacity to respond to exercise and re-education at any age. Even gentle, targeted exercises can help to restore better balance and strength, providing more support for your spine. The ligaments, those tough bands that hold your vertebrae together, also play their part. We mentioned they can thicken and lose elasticity. One specific ligament, the ligamentum flavum, which runs along the back of the spinal canal, has a tendency to thicken with age. If it thickens significantly, it can bulge into the spinal canal, becoming another contributor to spinal stenosis. It's like the wallpaper in a hallway becoming thicker and thicker, gradually reducing the width of the passage. Furthermore, as ligaments and muscles change, our proprioception can be affected. Proprioception is your body's ability to sense its position, motion, and balance. It's that almost unconscious awareness of where your limbs are in space. If this sense is slightly dulled due to age-related changes in these tissues, you might be a little less coordinated or a bit more prone to making an awkward movement that could strain your back. You might not feel as sure-footed or as stable as you once did, and this can subtly influence how you move and interact with your environment. It's also important to touch upon, very gently, how our overall well-being can interact with the physical sensations in our back. While factors like stress, anxiety, or feelings of loneliness aren't direct physical causes of disc degeneration or arthritis, they can certainly influence how we perceive and cope with pain. If you're going through a particularly stressful period, or if you're feeling a bit isolated, an existing backache might feel more intense, more persistent, or more overwhelming. Our emotional state can modulate our pain threshold and our ability to manage discomfort. This isn't to say the pain is all in your head, absolutely not. The physical changes are real. But our minds and bodies are so intricately connected. When we're feeling low or anxious, our muscles might be more tense, our sleep might be disturbed, and poor sleep can certainly exacerbate pain, and our focus might be drawn more intensely to physical discomforts. It's like turning up the volume on the pain signals. Conversely, feeling supported, engaged, and emotionally resilient can often help us to manage physical challenges, including back pain, more effectively. This is why a holistic approach, considering the whole person, is often so beneficial. Let's reflect again on that idea of cumulative wear and tear. This is such a significant factor because our spines have been with us, working hard, from our very first steps. Think about all the things you've done in your life. If you worked in a profession that involved years of manual labor, construction, nursing, farming, your back was subjected to repeated lifting, bending, and carrying. If you were an athlete, perhaps a runner or a gymnast, your spine absorbed countless impacts and performed incredible feats of flexibility and strength. Even seemingly less strenuous activities, if done repetitively or with less than ideal biomechanics, can contribute. For instance, if you always carried your heavy briefcase or handbag on the same shoulder for 20 years, that created a subtle, consistent asymmetry in the loading of your spine. Or perhaps you spent years bent over a workbench or a sewing machine. These aren't things to regret, they are part of the rich tapestry of your life. But acknowledging this history helps us understand why our backs might be telling their stories more audibly now. It's not about blame, it's about recognizing the journey. Many people share experiences like, "My back never bothered me until I hit my 60s, and now it seems to complain about everything." This often reflects that point where the cumulative effects start to make themselves more known, crossing a certain threshold. And our daily lifestyle choices continue to weave into this narrative. We touched on nutrition briefly, but it's worth a gentle revisit. While there isn't a magic back pain diet, a diet that is generally poor in essential nutrients and high in processed foods, sugar, and unhealthy fats can contribute to chronic inflammation throughout the body, which, as we've seen, can sensitize joints and potentially accelerate degenerative processes. Conversely, a diet rich in fruits, vegetables, lean proteins, and healthy fats, with anti-inflammatory properties, like omega-3 fatty acids found in oily fish, can support overall tissue health and help to modulate inflammation. Hydration, too, plays a subtle but important role. Your intervertebral discs, being largely water-based, benefit from you staying well hydrated. Think of the knowledge you've gained not as a set of rigid rules, but as a collection of gentle suggestions, options you can explore and tailor to your own unique needs and preferences. Perhaps you'll find that a particular stretch brings a lovely sense of release in the morning, or that paying a little more attention to your posture while reading or watching television eases that end-of-day ache. Maybe you'll be inspired to try a new form of gentle exercise, like Tai Chi or swimming, discovering a joyful way to move that also soothes your back. Or perhaps you'll simply feel more empowered to have a more informed conversation with your doctor or physiotherapist, armed with a better understanding of your own body and the questions you want to ask. Many people often wonder, will I ever feel completely free of this discomfort? And while that varies for everyone, focusing on improving function, on being able to do the things you love with greater ease, is often a more nurturing and achievable goal than striving for an elusive ideal of complete painlessness. Allow yourself to feel a sense of gentle empowerment. You are not merely a passive recipient of these age-related changes, you are an active participant in your own health journey. Every small, positive choice you make, choosing to take a short walk, opting for that extra glass of water, taking a moment to breathe deeply and relax your shoulders, or deciding to arrange your chair for better support, is a step towards greater comfort. These little acts of kindness towards yourself accumulate, creating a powerful momentum of well-being. As you prepare for rest now, or perhaps as you move into your evening, carry with you a sense of peace. Let any anxieties about your back gently dissolve, like mist in the morning sun. Trust in your body's innate wisdom and its remarkable capacity for adaptation and healing. Remember that even with the changes that time brings, your body is strong, resilient, and deserving of your love and care. The story of your back is interwoven with the story of your life, a life filled with experiences, movements, and moments that have shaped who you are. Treat that history with tenderness. Imagine, as you settle into your bed, that your spine is being gently cradled, supported, and allowed to completely release any tension it might be holding. Feel your muscles soften, from the base of your skull, down your neck, across your shoulders, all the way down your back, into your hips and legs. Allow each vertebra to feel as though it has a little more space, a little more ease. Let your breath be slow and deep, a gentle rhythm that lulls your entire being into a state of profound relaxation. If there are any lingering sensations of discomfort, simply acknowledge them without judgment, and then gently guide your attention back to your breath, back to the feeling of softness and support beneath you. You might even visualize a soothing, warm light flowing into your back, a light filled with healing energy, dissolving any stiffness, easing any aches, and bringing a deep sense of comfort and peace to every muscle, every joint, every nerve. Allow this light to permeate your entire being, filling you with a sense of calm and well-being. Know that as you sleep, your body undertakes its own quiet work of repair and restoration. You are safe, you are supported, and you are capable of navigating whatever comes your way with grace and understanding. Tomorrow, when you awaken, perhaps you will greet the day with a new sense of awareness, a gentler approach to your movements, and a renewed commitment to those small, consistent acts of self-care that we've discussed. Maybe you'll take an extra moment to stretch before you even get out of bed, offering a quiet thank you to your back for its support. Remember that this journey of understanding and care is ongoing, a continuous unfolding. Be patient with yourself, be kind to yourself. You are doing wonderfully. The peace that comes from understanding, the comfort that comes from gentle care, and the empowerment that comes from knowing you have choices, these are the gifts I hope you take away from our time together tonight. Let them settle into your heart and mind, bringing a sense of quiet confidence and serene acceptance. Your body is your home, and nurturing it with kindness is one of the most beautiful expressions of self-love. As the night deepens, or as your day gently winds down, allow yourself to simply be, to rest in this moment of calm, feeling gratitude for your body, for its resilience, and for the journey of life itself. The path to managing back pain in later life is one of gentle persistence, informed choices, and a deep, abiding respect for the incredible vessel that carries you through your days. And with each step taken in kindness, you move towards greater ease. Now, let your thoughts drift, let them become soft and light, like clouds, floating by, in a calm, blue sky. Rest now, rest deeply, and peacefully. Whispering, knowing you are well equipped, with understanding, and gentle care, for your back, and for your whole being. Sleep now, sleep soundly.